Administering oral medication. Purpose: to provide medication that has systemic effects or local effects on the gastrointestinal tract or both. Assessments. The assessments include allergies to medication, client's ability to swallow medication, presence of vomiting or diarrhea that would interfere with the ability to absorb medication, specific drug action, side effects, interactions, and adverse reactions. Client's knowledge of and learning needs about the medication, and lastly, perform appropriate assessments such as vital signs and laboratory results specific to the medication. Assemble the equipment and supplies. Medication cart, disposable medication cups, MAR or computer printout, drinking glass and water and or juice. Know the reason why the client is receiving the medication, the drug classification, contraindications, usual dosage rate, side effects, and nursing considerations. Number 4, check the MAR. Check the MAR for the drug name, dosage, frequency, route of administration, and expiration date for administering the medication. If the MAR is unclear or pertinent information is missing, compare the MAR with the most recent physician's written order. Report any discrepancies to the charge nurse or the physician as agency policy dictates. Verify the client's ability to take medication orally. Organize the supplies. Assemble the MAR for each client together. For the procedure, we must wash our hands and observe other appropriate infection control procedures. Unlock the medication cart. Obtain appropriate medication. Read the MAR and take the appropriate medication from the shelf, drawer, or refrigerator. Compare the label of the medication container or unit dose package against the order on the MAR or computer printout. Report discrepancies. Check the expiration date of the medication. Use only medications that have clear, legible labels. Prepare the medication. Calculate the medication dose accurately and prepare the correct amount of medication for the required dose without contaminating the medication. While preparing the medication, recheck each prepared drug and container with the MAR again. For tablets or capsules, place packaged unit dose capsules into the medication cup. Do not remove the medication from the wrapper until at the bedside. If using a stock container, pour the required number into the bottle cup and transfer the medication to the disposable cup without touching the tablets. Keep narcotics and medications that require specific assessments, such as pulse measurement, respiratory rate or depth, or blood pressure, separate from the others. Break the scored tablets only if necessary to obtain the correct dosage. If the client has difficulty swallowing, crush the tablets to a fine powder with a pill crusher or between two medication cups. Then mix the powder with a small amount of soft food such as applesauce. For liquid medication, thoroughly mix the medication before pouring. Discard any medication that has changed color or turned cloudy. Remove the cap and place it upside down on the countertop. Hold the bottle so the label is next to your palm and pour the medication away from the label. Hold the medication cup at the eye level and fill it with desired level, using the bottom of the meniscus to align with container scale. Before capping the bottle, wipe the lip with a paper towel. When giving a small amounts of liquid, less than 5 ml, prepare the medication in a sterile syringe without the needle. Keep unit dose liquids in their packages and open them at the bedside. Place the prepared medication and MAR together on the medication cart. Recheck the label on the container before returning the bottle to its storage place. Avoid leaving prepared medications unattended. Lock the medication cart before entering the client's room. Number 5, provide the client the privacy. Number 6 is prepare the patient. By checking the client's identification band, we can verify the client's identity. Assist the client to a sitting position or, if not possible, to a sideline position. If not previously assessed, take the required assessment measures. Number 7 is to explain the purpose of the medication and how it will help using a language that the client can understand. Include relevant information about effects. Administer the medication at the correct time. Take the medication to the client within 30 minutes before or after the scheduled time. Give the client sufficient water or preferred juice to swallow the medication. If the client is unable to hold the pill cup, use the pill cup to introduce the medication to the client's mouth and give only one tablet or one capsule at a time. If an older child or adult has difficulty swallowing, ask the client to place the medication on the back of their tongue before taking water. Document each medication given. Record the medication given, dosage, time, any complaints or assessments of the client, and your signature. If medication was refused or omitted, record this fact on the appropriate record. Document the reason and the nurse's action according to agency policy. Dispose all supplies appropriately, replenish stock, and return the card to the appropriate place and discard used. Evaluate the effects of the medication, and return to the client when the medication is expected to take effects. And that is all for administering oral medication. Administering intradermal injection. Purpose: to introduce drugs, bacteria, or their toxins, and other organic preparations to test whether the body is sensitive to the preparation injected. Equipment: 1 ml syringe or tuberculin syringe, needle gauge number 25 and number 26, 1/4 inch, aspirating needle, alcohol 70%, cotton balls, receptacles for soiled cotton balls and used needles, tray lined with sterile towel, drugs to be tested diluted to strength, distilled water for dilution. General considerations: observe the basic principles of giving medications. Report immediately any untoward effect of the drug. Observe strict asepsis. Avoid dangers such as causing an abscess, striking a bone, and capillary tissue damage. Needles should be sharp. Procedure: explain the procedure to the patient as well as the reason or purpose of injection. Counter-check the doctor's order. Prepare the drug or the medication. Obtain 0.9 ml of distilled water in the tuberculin syringe. Then, 0.1 ml of the drug to be tested. Use an aspirating needle. Replace the aspirating needle with an injecting needle placed in the tray. Assist the patient to assume comfortable position. Select the appropriate site. Clean it with cotton balls, wet with 70% alcohol, circular motion from inner to outer, and allow it to dry. Spread the skin of the inner aspect of the forearm or upper arm. Insert the needle into the skin as superficially as possible. 10 to 15 degrees angle with the level of the needle upward. The bevel is thrust through the epidermis into the dermis. Then the fluid is injected at about 0.05 cc. The fluid or drug produces a small bleb or a wheal. The needle is then withdrawn quickly but gently at the same angle of insertion. The area is not massaged because the medication may disperse into the tissue or out through the needle insertion site. Create a mark along the wheel or bleb using a blue or black pen. Don't use red ink since it could be mistaken for a positive reaction. Make the patient comfortable. After 30 minutes, observe the bleb or wheel formation after the result evaluated by the doctor, or let the attending physician interpret the result. If negative or positive result, let the doctor countersign in the doctor's order sheet and in the treatment record. Administering intramuscular injection. Purposes: to administer irritating drugs that would produce unnecessary pain if given subcutaneously, to obtain a more rapid reaction of drug than by subcutaneous route. Equipment: medication card, sterile medication, ampule or vial, sterile syringe and needle, cotton balls saturated in 70% alcohol or boiled and clean water for cleaning the site. Receptacles for used cotton balls and another for used needles and syringes. Tray lined with sterile towel. General considerations. Observe basic principles of giving medications. Report any untoward events of the drug after an injection as much as possible. Observe the patient at bedside. Observe strict aseptic technique. Avoid dangers such as causing an abscess, breaking the needle in the tissue, striking a bone, capillary tissue damages, hitting the veins. The needle should be sharp. For repeated injections, alternate sites should be used for injection. Give injections sufficiently deep so that no medication spills over into the subcutaneous tissue. Procedure: wash your hands. Check the medication order. Prepare the correct dosage of the drug from a vial or ampule. Protect the client's privacy. Expose only the area to be used for injection. Choose a site for the injection that has no broken skin, swelling, hardness, tenderness, redness, and warmth. Establish the exact site for the injection and assist the client to an appropriate position. Clean the site with the cotton balls, wet with 70% alcohol, using a circular motion from inner to outer at about 5 cm. Remove the needle cover. Invert the syringe and expel any excess air that may have accidentally entered the syringe. It may be necessary to flick the syringe to move the bubble out. Using your non-dominant hand, stretch or spread the skin or pinch at the site. This makes it firmer and easier to invert the needle. Holding the syringe between the thumb and forefinger, pierce the needle at 90-degree angle and insert the needle into the muscles. Rationale: using a quick motion lessens the client's discomfort. Aspirate by pulling back on the plunger. If blood appears on the syringe, pull out the needle and discard the syringe and prepare for a new injection. Rationale determines whether the needle is in the blood vessels. If blood doesn't appear, inject the medication steadily and slowly. Remove the needle quickly, pulling along the line insertion. Massage the site with the cotton balls or apply pressure. Massage is thought to disperse the medication in the muscles and facilitates its absorptions. If bleeding occurs, apply pressure to the site until it stops. Dispose of supplies according to agency policies procedure. Rationale, proper disposal protects the nurse and others from injury and contamination. Record the medication given, dosage, time, route, any client's complaints, and your signature. Assess the effectiveness of the medication as appropriate for the medication.